Creating the broadcast. Hi guys, what's up? Okay, we're gonna wait for a while. Okay, hopefully it's broadcasting live. This is the fourth module for the training medical certificate cause of death. Okay, so this is entitled Guidelines for Reporting Causes of Death in Specific Groups or Conditions. This is recorded live. This is streamed live. Okay, the first module was about the importance of why we are training medical students and other doctors, training how to do the medical certificate cause of death. What are the statistics that are affected? Okay, why it's important that every Filipino physician uh, does the same thing when it comes to writing down the cause of death. Okay, so I already introduced that this is a standardized DOH training that will be taught in medical schools, and I'm already doing it for the Manila Times College School of Medicine here in Subic. The target of this series of lectures are for those in MD 304. Okay, so these are third year medical students uh, who are also being taught about the old way on how to do the writing of the death certificate. So we have the second module, which is the legal mandates of what this is all about. Okay, and I introduce them to you guys. I will be putting down the links on the YouTube description box um, below this video. Okay, if you're watching this on Facebook, I've already uploaded the first two modules on Facebook. So by this time, and I'll be uploading the third module a little later tonight. Okay, so it's already evening, February 20, but our slide says that this is for the February 21. That's for tomorrow. Okay, for the third year medical students book. Okay, if you're watching or joining us on YouTube, on Facebook, uh, I I always show you guys this. So if you have watched the first three modules, okay, the last one, we've discussed general guidelines on how to fill up the medical certificate. What does it look like? Okay, so you can refer to that. Okay, now we're going to the specific causes. So there are ways to write on specific causes in the death certificate. Okay, so this is my certificate of completion, training of trainers on the medical certificate cause of death. This was given to me 2023 at the Xenia Hotel, Clark, Angeles City, Pampanga. So that's me on the green shirt. I was wearing the green shirt at the back. Okay, hopefully you can see this on YouTube. I think the stream is not that good. Okay, not that good. Wait. I think you can see other people in there. Okay, so other people in there. There are other people in here with me. Okay. Let's put on the pointers. Most of these are doctors here practicing public health in Region 3. We're the second batch on Region 3 to be taught the medical certificate cause of death. Okay, so we are training other doctors. However, there is still resistance, okay, on how to write down the uh, cause of death in the um, in the current form. Okay, so we're going to show you what I mean. Uh-oh, yeah. I've mentioned on the last module that I've distributed the pretest on some of my students on the third year medical students on MD 304 okay, in TMTC. So these are how they were taught. Okay, I want to show you how they were taught to write the death certificate. This is also how I was taught, but we did not have formal education death certificate, writing the death certificate on my before clerkship. So I met writing the death certificate with residents and interns during clerkship. Okay, it was not a formal instruction. This like it's more like ganito ganito yung madalas nating ginagawa. Yeah, sulat. This is how we're customarily making it. Okay, so here is an example. Okay, so of the pretest I gave them. So it's not wrong answer, but there is a better answer na. Okay, because of the guidelines set forth by AO 2020-0008. So important that we know about that because that is going to be the standard and all health facilities and including municipal health office, municipal and city health offices will be checked, okay, will be assessed in the future po, okay? So it's important that we follow the new guidelines. These new guidelines, this is not an initiative dito lang sa Pilipinas. So the ones that you're going to learn here is also followed globally. Okay, we are sort of delayed na, late na po tayo. We're late already in the upgrading of the writing of the death certificate because if you search on Google, you're going to find that third world countries, like I mentioned this in the previous module. Okay, if you watch that, okay, that third world countries are already following this method of writing the death certificate, but we, a developing country, the Philippines, we're still not following. Okay, and this is how we are writing down the death certificate here in the Philippines. Okay, so 59-year-old male admitted to the hospital with shock signs of septicemia, along with gangrene of the left foot. Patient noticed a small painful wound on his left foot a week ago. Pain increased with swelling of the foot and fever 4 days before admission. 5 years ago, he was treated for diabetes mellitus type 2. In the last 2 months, medicines for diabetes and other ailments were not taken due to financial limitations. Patient then died 2 days after admission due to septic shock. Okay. Uh, we're going to go with infectious diseases here. So we're going to show you lang muna, okay? So we're not going to comment much on it on what went wrong here. So immediate cause, septic shock. Antecedent cause, septicemia. Okay? I already mentioned that on the previous that we're not supposed to be using septicemia. Okay? So we're going to uh well, we're going to answer it later na lang. Okay? Kasi, well, we already touched on it on the previous lecture. That it's if there is something that's much better, you put it there. So this is an example of um, residents trying to tell you or other senior hospital authority trying to tell you to fill up all of the lines. Okay, so actually you can omit this and just put this gangrenous diabetic foot. Okay, diabetic foot, left, right, on his left foot. Okay, diabetic foot, uh left. Okay, or gangrenous foot, left. Okay, underlying cause diabetes mellitus. The diabetes mellitus is a significant contributor to the death and is the actual underlying cause. Okay, so this one should go here. Okay, so a little comment lang. Okay, a little comment. But we're gonna go how to write things with infection on later slides. Okay, so this is something. This is something. This is from the last lecture. So this is something that I'm going to show you. So let's just go to the next example. So we're just showing you examples lang muna, okay, on how current doctors are Filipino doctors are writing down their death certificates. Okay, so this is a pretest. This is not an actual patient. This is not an actual death certificate. So, 23-year-old female admitted to the hospital for severe burn. She allegedly poured kerosene on her body. So, it's a suicide. And used matchstick to burn herself in her garden. On examination, she had 60% neck and body surface with 25% third-degree burn. So her burn wounds were infected with staphylococcus on the second day of confinement. So there it is. That thing has to go there. Staphylococcus. On the fourth hospital day, she developed high fever and chills and died during the night. So it's septicemia. Okay. One thing I noticed with septicemia is that most patients have jaundice. Okay. So that's something I always ask, okay, because I keep writing these death certificates and allowed by a patient. Okay, it signifies that the liver was one of the affected. It's just trivial. I always notice this with uh, septic patients. Okay, so immediate cause, septic shock. So there's the word shock again here. We're gonna use in our last lecture we use traumatic shock. Okay, now is it nice to is it wise to use septic shock? Maybe you can omit. Okay, because there is something else that is much better, much better here. Okay, so staphylococcal infection, we're going to go with how you're supposed to write this down. The sepsis is not anymore used. There is a way to put that in there without using that. So we're going to go back to this example and answer it correctly as we go along. Underlying cause burn, 85% TBSA. Okay, so we're gonna go for it. Maternal condition, none of the choices. She's a female. Okay, the disease is 15 to 49 years old. You have to check. So it's none of the choices. Very good. And then manner of death, it's a suicide. Very good. She noticed it already. Place of occurrence of external cause, home. Very good. Autopsy, yes. Okay, so it's okay. It's okay. The medical students are answering exactly how current Filipino doctors are writing down their death certificates as of today. Okay, so this is why I'm recording this to teach everybody. Okay, 25-year-old female, G5P4. So this is pregnant. Had a full-term normal delivery at home. Okay, so okay. On the fifth day of postpartum, she had fever and pelvic pain but ignored it for 3 days. On the eighth day postpartum, she was brought to the hospital. In severe pain, highly febrile, very pale with foul smelling vaginal discharge. Ta-dan! You can already, there's a couple of things already on your mind as to how, or you're speculating already as to why there's this foul smelling vaginal discharge, why yeah, you're thinking retained placenta here. Possibly. Okay, this is a normal delivery at home. So uh, it may signify actually it can even signify other uh peripheral infection. Okay, so we're going to go with this one later naman. Uterus was involuted and had tenderness over both fornices. Okay, so right and lower left lower quadrant probably was very painful and with tender with guarding. She was found to be severely anemic, losing blood. Antibiotics against Staph aureus and blood transfusion were given. On the next day, the patient developed oliguria. Boom. We have renal failure already. Hypotension and was managed for acute renal failure due to puerperal sepsis, but eventually died. This is their working diagnosis. Okay, but she died. Okay, very good. You got that one. Unfortunately, both are garbage diagnosis. Acute renal failure, like I said on the past, is not anymore, not supposed to be used. Okay, If you're going to use it, you may put something else in here that may be contributory, okay, to the cause of death. Boom, severe anemia. What? Okay, so what do you notice in here? These are all, this is laboratory findings. The severe anemia was because of that, okay? You can even put hypotension here if you want, but it's all just findings, not the actual cause of death. Okay, this is not. I'm going to explain to the student. This is uh, not well. It's not contributory. Okay, that's why we correct. Okay, if the medical doctor happens to give me this, I'm going to have to return and suggest other things that may be placed in here that may have a significance in the public health records. Okay, so yun lang, wala dito. You cannot find any cause of death. Okay, ako meron na, di ba? Kanina, I'm already considering something. Okay, because this is an acute abdomen. Acute abdomen. Uh, there's bleeding and hypotension. Okay, they were unable to find the cause of the bleed. Thus, patient died. Okay, so mamaya na. Mamaya na natin siya sasagutan ng tama. Okay, so other significant contribution to the death, very good. Very good. Okay, patient is multigravid. Da. Okay, which is one of the things that could cause this uterus was involuted in untenderness of both fornices. So there's already a clue there. Okay, home delivery, very good then. This is nice to note. Okay, for the statistics. Maternal condition, check. It's less than 24 days after delivery. But 24, yeah, yeah. It's 42. This is supposed to be 42 days. Sorry, guys, I sent you a typo. This is supposed to be less than 42 days after delivery. Because I noted that on the um previous uh, lecture. So let's go to the next example. 54-year-old male been taking medication for coronary atherosclerosis. So patient already has uh, underlying cause already in here, coronary atherosclerosis. Over the last 5 years. So if you're going to write interval, this is supposed to be last 5 years. This is missing. The interval is missing here. Okay. Rush to the emergency with a history minutes of severe tightening chest pain, sweating, and dyspnea. He became unconscious and emerged and later died. ECG confirmed acute myocardial infarction. Boom. That's the immediate cause. Okay, acute myocardial infarction. We're not supposed to use the cardiorespiratory arrest anymore. This is always there. If they say a systole, they're going to the doctor or the student will put a systole here. If it says BFib, the doctor or student may place ventricular fibrillation in here. Those are ECG findings and are not contributory to the cause of death. So this thing can be moved in here, and this thing can be moved in there, and this may be left blank, but it'll be understood that the underlying cause will be the last one. So the last one, the last entry will be the coronary atherosclerosis, and that's going to be in the uh, statistics. Okay, so this is easily corrected because this was on the previous module. 21-year-old female critically injured in an automobile accident. Okay na, ito na yun. So, you see the passenger? Rush to the ER. You see the passenger. So, passenger in the automobile accident. Okay? So, magkukwento ka ngayon sa underlying cause. You're gonna tell a story in the underlying cause. So, that's on the previous module. We already placed that there. That you're going to do, oh no, am I in the way? Okay, I'm not in any way. Uh-oh. So sorry about that. Just trying to move my face so you know that I am actually talking. Fractured skull, declared dead on arrival. So there's is blunt force trauma, unless there's a okay critical injury. Record indicate that she was the driver. Okay, driver in the automobile accident. Driver of a car in a two-car collision. That's much better. A driver of a car in a two-car collision. That's how I would write the underlying cause. You're going to learn that later po. Don't worry. Don't worry. Then we're going to put Malakas Street. Oh no, bakit hindi ito nakalagay? Si Malakas Street. Go back, go back, go back. I thought I edited this one. Ay, the editing was not saved. Sis. Oh no, it did not. I guess it did not copy over. Okay, that's okay. That's okay. So, this is a death by external causes. So you're going to write down that this is an accident. Okay, this was an accident. And then that Malakas Street will find itself on the death certificate. Okay, where did it occur? I already discussed the importance of writing down the uh, street, okay, or the avenue where it is because of statistical purposes. Antecedent cause, so we're going to go with that again later because of death by external causes. Immediate cause, fractured skull and cerebral laceration. You can put fractured skull and cerebral laceration here. Both of them are in here, okay? Immediate cause will be in here, which is on the previous one is traumatic shock, but this one is actually fractured skull. Okay, so this is a head injury. This is a head injury, and then you can also put alcohol toxicity here on antecedent cause. Okay, later na, later. We're going to see. You're just trying to tell you guys how this is written by medical students. Also, if you find yourself a doctor that thinks that there's nothing wrong here, okay, you're gonna learn something in this module. This is the most um longest and most important module because this is where most of the question lie. Okay, so that's why I'm pacing myself, trying to do this a little slow. We can't go through this fast. Alright, so our specific objectives: identify the various groups and conditions, discuss their respective principles, and properly report these deaths. Okay, good, good, good. Let's just keep going. So I placed objectives and then kasi I just edited it. I just received their pre-test just now, and then I'm showing it to you guys and how they were able to answer it. And it is surprisingly the same way other practicing doctors are writing their death certificates because I just looked sa mga death certificates here in Olongapo and it's the same. Okay? Parang hindi ako nag-training ng ibang doctors last year. Okay? So they keep reverting back to their old practices. So this is supposed to be the new practice now. Okay? The new standard in writing down that certificate. Cause of death in specific groups. Groups. What are the groups? Fetal, infant, women of reproductive childbearing age, elderly. We're going to discuss them one by one. Conditions. So yeah, infection. Neoplasm. I had a pretest question on neoplasm and just did not put it, so I can start it already. Start it already. We're going to show it naman to you guys. External events. That's the one na yung magkukwento. Injury and then peri-procedural. Okay, that this one. Merong isa pang pre-procedural. We're gonna discuss that a little later. Fetal death. So this was given. The definition was given on the previous lecture. It's a death prior to the complete expulsion, so prior to birth. Okay, for product of conception prior to birth. Is irrespective of the pregnancy period. So it's mandatory for fetuses with at least 20 weeks age of gestation or weight of at least 500 grams to have the certificate of fetal death. So in order for that to be valid, you also have to write down the certificate of live birth. Okay, so I've already discussed that on module 2. You can refer to that on the description box below. So I'll be editing, doing some rough editing. For the medical students, this will be the last one, the last lecture you're going to have to take. There's going to be a fifth and a sixth and a seventh lecture for if you want to continue. Those are monitoring in the Smart VA po. I'll try to do those slides, but I'm prioritizing the medical education of third year medical students po muna. So report all fetal deaths with at least 20 weeks, 500 grams or more can be due. So fetal deaths can be due to disease or condition of the placenta, cord, or membrane. So placenta, cord, or membrane that adversely affected the fetus. Okay. Next, we're not going to teach you how to diagnose those, okay? But the even I have problems with writing down fetal death because I don't this is not my usual my usual clientele kasi sa mga OB-GYN ito at saka sa mga pediatrics, okay? So my clientele is usually in the working population, 4Ps, and anything that's in the community. So bihira because this usually are referred to the hospital. So yung mga nagtatrabaho sa hospital will gain much about this writing of fecal death. Okay? So A, main disease or condition of the fetus is the single most important disease or condition that caused the fetal death. If there's uh, one important disease or condition, you put it here on the letter A. So B, complications, other disease or conditions of the fetus. So complications of the main disease or other disease condition contributing to the death. Okay. And letter E, any other condition or disease of the mother, as condition or disease of mother nor the fetus. If there any other disease or condition that cannot be identified as that of the mother or the fetus, you write it as and put that on other relevant circumstances. Okay, because that's a condition that's neither that of the mother nor the fetus. So it's just an example. Okay, that thing is placed there because there may be others. Okay, I haven't had experience much on writing fetal death certificates. Okay, so this is an example. 38-year-old G3, two. So this is a G3P2. Okay, this is a DOH slide, so I just copied it over in my slides. A 38-year-old G3P2, probably. Okay, 2002. There's no previous complications sa may pagbubuntis. Was confined for premature labor, except this time she had premature labor. On the second hour of observation, the physician noticed no fetal movement and heartbeat. So that's, I know, for immediate cesarean, possibly. Okay, if there was if the mother would say that she felt a kick not 10 minutes ago or 30 minutes ago, that could be an emergency. They could try to still revive the baby. Okay, she eventually delivered an hour after a stillborn baby boy with a cord around his neck. So yun. Kaya sometimes this doesn't happen because the OB-GYN usually tries to do a cesarean here. But if hindi, okay, uh, uh, this could be probably na since this is a G3, P2 probably sa lying in. In the lying in, she probably was brought to a lying in, a midwife or an untrained, uh, um, a trained worker, health worker may have seen this, but did not identify that this could still have an emergency. Okay, so I've seen how OB-GYNs do this. They put a lot of oxygen on the mother, trying to give oxygenation to the baby boy that will probably have cord coil just like in this one. So possible. Okay, this is possible. We're not blaming people when this is happening. When this has happened, okay. So the fetus, 34 weeks age of gestation, was cyanotic with no gross fetal movement nor heartbeat. So patient is declared dead. Okay, fetal death. This is fetal death because the death happened prior to the birth. Okay, so fetus died. One, before labor. Two, during labor or delivery. Three, unknown. So she's already on the second hour of observation. This is a physician. That this is a indication of cesarean already. So two, we put it two. Check that during labor or delivery. Okay, so length of pregnancy, 34 weeks. Attendant, physician. Okay, so yun yung problem dito. Hindi alam. Hindi alam ni doctor that this is already referable for, well, we don't know. I'm not an OB-GYN. If you think that I'm right, I'm wrong, okay? It's okay. If you think that I'm wrong, you can place down anything, comment it down below. Okay, I'm not an OB-GYN. I'm a community doctor, a rural health physician. I just happen to have had experience with this before, where we delivered a baby boy in a setting, in a hospital setting. Okay, everything was so fast. It went so fast that we were able to saved the baby. Okay, he was blue inside. Okay, when we delivered, but due to the uh, intensive intensive care unit in the NICU resident fellow. Okay, the baby was saved. Okay, so I saw how aggressive they were when trying to save the fetus. Okay, so the fetal death was averted. Okay, so yung isang example po, I saw one of these happen. Two, this actually happened in my during my training. Okay, so fetal death, single cord coil around the neck. So ganyan siya. Ganyan siya nilalagay. So it's not just cord coil. So it's a single cord coil around the neck. Okay? So that's the main condition that led to the death. That's it. Pwede na nga yan. Hindi na malagay yung iba. Okay? But if you have other disease or conditions of the fetus, see this one? This is an actual DOH slide. So I mentioned during the last module that if you are to use garbage code, so like this, asphyxia is considered a garbage code. You have to follow it with a better cause of death, asphyxia, and then prematurity, 34 weeks age of gestation. Okay, so if you're going to use this one, okay, you can remove this and just write premature 34 weeks age of gestation, prematurity 34 weeks age of gestation, in here in other diseases of the fetus. So main maternal disease or condition affecting the fetus, it is a premature labor. Okay, so it did not reach 36 weeks pa, already had premature labor, so it's going to be written in here. Okay, so this is simple lang. Okay, we're not writing down the whole chart because this one you can put a lot of things in there. Stillborn, so I am guilty of that. I placed stillborn already here. It's not even going to help in the statistics. Okay, so it's filed somewhere in the Philippine Statistics Authority. I placed the stillbirth because I don't know how to properly fill this up before. Okay, so now we have this. You can refer to these slides. The slides will be available to my medical students. I'll try to upload them in my website at zeromelia.com. Okay, try because I'm going to change the whole thing because apparently there was a problem with my website. Okay, so I'm going to have to revamp the whole thing. And this will be found, the slides here, I promise I'll have them placed on my website, okay, so that it's easily downloadable. And you can refer to this. Okay, this is the wait. I'm still on the way. Let's get me out of there. So this is very, very important. So I suggest if you are watching this live or watching the recording of this, you screenshot this as an example of fetal death. Okay, because that's what I did. That's what I do. I actually open this up, this PowerPoint up while I'm working, so that if that certificate comes, I get to refer to these examples so that I can write them down then. Okay. Eventually, you're going to um, not use this once you have already memorized it. Okay. So fetal death case, another one. So let's go. 30-year-old G2. He did not write if it's P1. So G2 P1, probably 1001, was admitted in the hospital due to 1 week of no fetal movements. And it says a problem of public health. Okay, because every mother, we keep telling every mother that 10 dangerous signs of pregnancy in every antenatal visit. So if yung nanay ay nagpa-check up, kinukwento namin kung ano yung 10 danger signs. So that's important na magkaroon ng checkup, at least one antenatal checkup. If this happens, no fetal movement, it's already too late. 1 week is already too late. Okay? So, if hindi gumagalaw si baby, tatakbo na saan? Emergency room. Okay? Well, this happens. Okay? This happens quite commonly. Gusto mo sabihin rarely, but this happens actually quite commonly because of lack of antenatal visits. Okay, so sa amin, we try as much as possible. Olongapo is very manageable pagdating sa mga ganito. Kasi because of the small geographic area. Pero the population is big, okay? Pero doon sa ibang lugar, where the population is spread out over a large geographical area, uh, the health centers may be many, but may not be enough to reach yung to reach all the population. So this is actually a problem in the public health system. Okay? Hindi nasabi dito sa mother na kailangan wala ka nararamdaman na pagsipa ni baby o galaw ni baby, you go directly to the emergency room. So ultrasound of the fetus at 36 weeks age of gestation revealed the presence of anencephaly. So possibility here is that nagpa-antenatal checkup, nakita anencephaly, hinayaan na lang ng nanay na. So, pwede, or this may be the first time. We do not know the actual, ito lang yung binigay sa atin na case. This is what is given to us in the case. So, we're just speculating at this point. So, ultrasound of the fetus at 36 weeks age of gestation revealed the presence of anencephaly. An hour after admission, she had labor pains and spontaneously delivered a stillborn weighing 1,500 grams. So, I was able to have one. Yeah, I actually delivered an anencephalic infant. Okay, he was alive for about 2 minutes or 1 minute. Okay, you actually see him cry, but you actually see his brain. It's not. You can see this brain, but it's very transparent. Yeah, well, you see the outline of the brain. Okay, so it's flat. Okay, an outline of a little brain there. Okay, he's going to cry a little bit, and that's the last breath that he's going to take. He just does one, and then he's dead. Okay, so that's my experience with anencephaly. So I already saw this. Usually, anencephaly happens. The birth of anencephaly happens not 36 weeks as of gestation. So Usually it's premature, okay? Pero ito, 36 weeks, no? Tapos anencephalic. This must be a big baby. But it's 1,500 grams. It's a small baby. Okay, let's go. Fetus died before labor, okay? Because it's already 1 week, no fetal movements, okay? So, as given in this example, some patients I've met have been offered by their uh, private practitioner that they undergo therapeutic abortion. Okay, so isa yan sa mga I've mentioned this before. Okay, so that's something na hindi legal dito sa Pilipinas. So this is actually okay what doctors are really doing. Okay, so inaantay talaga nila na mga anak yung ano even though it's stillborn. Okay, so it'll be stillborn, stillbirth, pinapabayaan pa rin na lumaki yung mga fetus. So that's the recommended practice here in the Philippines po. Okay, so if you are from outside the Philippines, where therapeutic abortion is legal, okay, so there's meron eh, okay, so uh, there are some of you that may say, "Ah, hey, why did this have to happen?" Okay, because this is how we do this here in the Philippines. We do not advocate yung abortion na yan, therapeutic abortion. Okay, so so yan. Patient died. Okay, fetal death. We record this as fetal death. Signed before labor, 36 weeks. Physician. That's already given. So fetal death, anencephaly. So hey, maraming pwedeng nangyari. But we're going to write anencephaly. Okay? Let's look back again. Okay? So, no fetal movements. Pwede mo ilagay. Possible ganito. Anything at this point is just speculation. What you know, okay, you put it in here. So, anencephaly. Under disease or conditions, prematurity, 36 weeks age of gestation. Okay? Hindi ka magsasuspect ng cord coil. Is it cord coil or is there any hematologic problems? Unless you have actual evidence of that, you don't put it in here. Okay? Kasi dati, that was how I was taught. Possible cord coil. To consider. Okay? The to consider is no longer placed. Okay? If you saw a cord coil, you put it here. If you did not see a cord coil, you do not put anything in there except main disease or condition of the fetus. The anencephaly will be placed in there. So this is a congenital condition. So this will be placed in the top 10 leading causes of death under that category. So yun po. Prematurity, 36 weeks age of gestation is other conditions. Okay. Maternal disease, nothing there. Okay. So yun po yun. So just take note of that or screenshot it if you cannot have access to this lecture yet. Okay, so infant death, age 0 to 7. What do you do? So namatay si baby, nabuhay si baby, but he lived for less than 7 days. So still use the form 103, but you're going to fill out the back portion. So I showed this on the last module. Okay? Module 3. Fill out item 19A at the back of the form instead of the 19B in the front. Okay, what does that look like? It's the same. It's the same. For dun sa may causes of death. Okay? This is the back form. This is actually on the top of the back form. With the addition of age of the mother, I already showed you this one if you know sa may module 3. So those who don't haven't followed that one, it's just following now. So we place the age of the mother here. Method of delivery, was it a normal spontaneous delivery, cesarean, okay, vertex, or length of pregnancy in completed weeks, you place it here. Type of birth, is it single birth, is it twin? If it's a twin or a triplet, which one was he? The first one, the second one, or the third one? Main condition of the infant, just like before. Other diseases, conditions of the infant. Minsan, yun naman yung difference po. Boom. This one is fetus, fetus, fetus. This one is infant, infant, infant. Okay, so infant, age 0 to 7 days. The mode of dying should not be entered in this section. So that's the problem. Okay? Yan. Dito na natin yung ilalagay. Mode of dying, asphyxia, heart failure, anoxia. Yan ang mga tinuri sa akin. Yan ang mga nakalagay sa mga fetal death. Mas sinilapan ko before. Would you, way before, because last, uh, I like, the last fetal death form I filled up was like 3 years ago. Okay? And that was due to COVID. This one uh, is very rare in my practice. So I do not usually write them down. But in the preview, after during the beginning of my career, these are the ones I write. Asphyxia, heart failure, anoxia, because that was how I was trained by residents. Okay, not by the DOH. There was no formal training paano maglagay ng fetal death. So prematurity should not be entered in this section unless it is the only known condition. Unless it is the only known condition. So, pwede pa rin, but if hindi mo meron darating na mga uh, relatives, okay? So, sometimes there's maternal and infant death happening. It's the surviving member of the family, like the father, will be the one filing for this, and usually due to shock or ano, walang ma-remember. Okay? There may be details that may not be remembered by the surviving members of the family. Or, yun. So sometimes we can write undetermined. Okay? Yun yung nakita doon sa mga statistics na note certain conditions that were not undetermined was not placed in here. So you can write undetermined. Okay? There are certain circumstances like that the surviving relatives have no idea, but they have to file the infant death certificate. Okay, the death certificate for the infant. Okay, next example: 38-year-old G3P2, so 0120, telling me that patient already has a previous abortion. Admitted in the birthing facility while 29 weeks pregnant, she had premature labor for 6 hours and subsequently delivered a very low birth weight infant. The infant was treated at the intensive neonatal care unit but subsequently died after 24 hours. So nadala pa sa NICU. Patient is alive, treated in the NICU but died. Chest X-ray of the infant shows dense lung fields consistent with severe hyaline membrane disease. Already, meron ka na, no? Severe hyaline membrane disease. Okay? Can be placed as what? The name. The age of the mother was 38. Method of delivery, normal. Length of pregnancy, 29 weeks. You are to fill this up. So type of birth is a single birth. So if the multiple birth child was, you don't place anything. Next. Children age 10. Yung cause of the hyaline membrane disease is an old name. So it's called neonatal respiratory distress syndrome. That's the new name. So you can actually place neonatal respiratory distress syndrome. It resembles that of an adult, no? Yun, adult respiratory distress syndrome. Halos, okay, but nangyayari lang sa mga uh, kakapanganak lang. Okay, so premature, so yun na yun. So the cause of death is that, okay? Final. Uh you can turn out the lights and call it a day. Okay, pagka mag-write ka ng death certificate, just na yun ito respiratory distress syndrome. That's okay. But if you were able to get prematurity, 29 weeks age of gestation, ano pa, isa pa? There's another one, diba? Yung very low birth weight. You can place them here. Okay, other diseases. So this is plural. Conditions. That's plural. Pero very low birth weight is can be placed under the prematurity. So you can choose that. Okay, or you can also write in there. 29 weeks age of gestation. So Why you call it prematurity? So 29 weeks age gestation. Maternal condition, premature labor. Okay, maternal disease condition, other. Previous spontaneous abortion. So I was able to note that, diba? Kakabasa lang natin and I was able to note that the patient already had two abortions. Okay, that was the first thing I noted. Okay, and that can be placed here. Okay, if you have if you are able to get this is a very good physician or healthcare worker with good verbal autopsy skills kung makukuha mo yan lahat dun sa may surviving um, relative or if the buhay yung nanay makukuha then itong mga details na ito. Okay, so next, reporting requirements for fetal death, Form 103A, the fetal death, certificate of fetal death. Okay, it's in the front. This one is in the front. Infant death, you fill up municipal form 103, and then you use the back portion. Okay, to write it down. So this is for children 0 to 7 days. Next, maternal death. Death in women of childbearing age. So women of childbearing age. So it's not necessarily na buntis at the time of death. So this one is maternal talaga. So from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental cause. Okay, so this is always asked, not from accidental or incidental. What's the difference? It's not defined. Okay, this is a standardized slide. This actually comes from the WHO definition. So I researched this one. It comes from the WHO definition that came out 2014. Okay, but they are from that year up to now, 10 years now, nobody was able to come up why they have to put accidental or incidental in the definition. Okay, promise, you'll find that out if magaling ka mag-Google, that there is an actual forum asking what's the difference between accidental or incidental cause. And now, why do you separate those na with accidental or incidental cause? Because there's a specific formula for the external causes of death. Okay, so later po yan. Next. Causes of death, 15 to 49 years old. So as long as the patient is of childbearing age, 15 to 49 years old, check one of these boxes. You are going to find this in here. So if it's not pregnant at the time, not or nanganak lagpas ng 1 year, boom, none of the choices. Okay. Next. So always remember the interval. This was mentioned in the module 3. So not always place the interval. Next. 36-year-old G52112 woman who delivered a full-term baby boy at home was brought to the ER because of placental retention. Boom. We already have a cause of death. She apparently had severe bleeding and was hypotensive on her arrival at the emergency room. It's stated there. That's why it's easy. So probably the healthcare provider was unable to can identify no pwede. Okay, or this was the working diagnosis. So blood transfusion and manual placental extraction were performed and it's bloody. Okay, this placental extraction, manual placental extraction is very bloody. So blood transfusion sometimes is the first therapeutic management, okay, to prevent any more semi-manual placental extraction. So yeah, but unfortunately, she still died 4 hours after delivery. So patient is pregnant, nanganak, okay, nanganak na. 52112. Does it equate? Parang dalawa, dalawa buhay. Okay? Hmm. What happened to the other two? Possibly dead. Okay. So, di pa nakalagay na P5, no? So, something here. Something to note here. This is not my slide. Okay, if this was my slide, I'd write it down. G5, P5, buhay yung full term, you know? So, this is 3112. Tama ba? 3112. So, 2112 is equivalent to 224. Four children lang yun, you know? So, 3112. G5, P5, 3112 will be my obstetric score. Okay? So, kung ako yung nagsulat, if I was the one who wrote this, this is actually from the PDF given to us by the Department of Health. So yeah, C, less than 48 hours after delivery, days after, less than 42 days after delivery. Okay, namatay si mommy. Mhm. Immediate cause, postpartum hemorrhage. Less than 4 hours. It's noted, diba? Patient has postpartum hemorrhage. Ah, it's not mentioned. Okay, so it's not mentioned in here, but the severe bleeding, you place it there, less than 4 hours. Actually, pwede siyang umangat lahat. Okay? Angat dito, uterine atony, less than 4 hours, and then retained placenta, about 4 hours po. If you place it there, it's not a mistake then. Okay? Because this is a mechanistic postpartum hemorrhage. Okay? Pwede rin naman siyang ilagay din dyan if you want it to be significant po. Okay? So, postpartum hemorrhage, less than 4 hours, or since this is a diagnosis na uterine atony, it can go up. Okay? So, yun po yung ano namin. Na pwede as much as possible yung simple lang. Okay? Wala na yung mga mechanistic. There's no more mechanistic na. But this one is an example na pwedeng pagbigyan. Postpartum hemorrhage is a condition. Is a maternal condition that is also that is a cause of death. Okay? So, retained placenta ang magiging underlying cause. And this is the one that will be in the statistics. Okay, so less than 42 days after delivery. Next. Ah, okay na. So that's an example of the maternal death case sample. So ito, screenshot. Okay, so that you can use this in your practice. Elderly deaths. Most of the elderly apparently die with the disease and not from them. Okay, so these ones are the ones that was used before. Old age. May mga lumalapit na mga relative, hindi matanda na siya. But that's not something that we put. This has no place in health planning or research. This has no place now in the medical certificate. You don't put old age, senility, senescence, which is actually, this three is, what do you call this? The same thing. Okay. Homonyms, what do you call this? Of each other. They mean the same thing. Then advanced age, oh yeah, those things are meaning the same thing. But multi-organ failure, like I said before, there was actually a guideline. You write only multi-organ failure if the failure was documented in two or more organ systems. However, now we do not put them na because they have no value. Okay, you place the actual cause of death. Sample: 95-year-old man was found dead on bed by his wife. He had chronic mild hypertension controlled by medication. If you stop there, that's mostly what I meet in the practice. So I put hypertension lang. Okay. But here, previous chest x-ray shows mild cardiomegaly. Magaling, meron pa silang x-ray na napakita sa iyo. Consistent with chronic hypertension. Yes, very good. I keep explaining that to the patient. Okay? Why lumalaki yung puso? It could be due to a previous insult or to a chronic insult. So one of them is consistent with chronic hypertension. There was no suspicion or evidence of foul play. Always ask evidence of foul play pagdating sa elderly. because there some of the deaths are clearly due to neglect. No specific cause of death could be identified. Nalagay mo old age? Nope. We have a new one. Okay? Undetermined natural cause. The interval could be placed as hours. So this one I keep referring to if the relative is usually anong tawag mo doon? Mm, hindi siya ganun ka-close. If the relative is not that close to the deceased, close in terms of emotional or close, okay? So relative siya, usually the apo or the grandkid, na kailangan mag-file ng death certificate ng lolo niya na wala siyang alam na kahit na ano, okay? Kahit na anong piga mo na, even though you're trying to do the best in verbal autopsy, you can't get anything. You place undetermined natural cause, but can you put hypertension? There was a mention of hypertension. Yes, actually. You can place hypertensive cardiovascular disease dito. Okay? Or hypertension. Kasi that is identified. Okay? Na he has hypertension. So if you want hypertension to be placed in you place it in here. And then you place it as previous sorry. You place it as years. Okay? Or you can place that below. Yeah, no, no, nothing. Pagka naglagay ka ng undetermined natural cause, this is supposed to be one line lang. Okay? Undetermined natural cause, hours. Pwede yan. Pwede rin po yun, hypertension for years. Okay? Wala nang lalagay dito na electrolyte imbalance secondary to hindi na kumakain. Okay? So, those things are not to be placed there anymore. So either you just place a condition that you want na maging statistically significant for decision makers like that. If it was me, I'll place hypertension, okay, and put in here years, okay, onset and then death. Elderly deaths. If the cause of the elderly death cannot be determined and seems to be due solely to a natural cause, may report undetermined natural cause. So you know, if the cause of death cannot be determined, you just place their undetermined natural cause. If uncertain, if the death entries probable or presumed is acceptable. Okay? If uncertain in the death, this is the time that you can say probable. Uh, probable myocardial infarction. Because the patient was happens to say na masakit pala yung dibdib, that there was chest pain the night before. Okay? So, meron yan. Ganun. You can place probable or presumed myocardial infarction. Pwede yun. Pwede yun. Para lang nasama siya so that it will be included in the overall the statistics po. Elderly deaths, undetermined natural cause is acceptable since it will prevent reporting another conjectured guess and baseless cause of death. So, imbis na magsinungaling, yun ang ibig sabihin natin. This is, don't speculate. Okay? If it's not, uh, if there's a possibility that it's not the cause of death, don't write it down. Okay? Because you may be inflating the statistics that is not needed naman to inflate those statistics because of possibility of the funding of the decision makers to certain priority programs, diba? It can affect those who are living still kung ano yung popondohan ng mga ano po. I've discussed this one on the first module. Bakit napaka-importante na. Yung tama, okay, if hindi ka makakapag-contribute, you can just put undetermined natural cause. So yan, abuse or neglect. Okay, especially if nakita mo yung pasyente and nakita mo mahaba yung kuko. You saw the patient, there is a very long nails. Looks like me, disheveled. Okay. I'm disheveled right now because of the pain I have on my left leg and foot. Okay. And I could not move that well, like I did before. Okay. So that's why I said I look disheveled because uh, of neglect. So makikita nyo din yan doon sa mga elderly if you see that they do not look like they are cared for, there may be a possibility of abuse or neglect. Like I said in the second module where we discussed kung which one is reportable or not reportable. If you suspect, you report it to the PNP. This is the general public. If the patient is a possibility ng extrajudicial killing, as an VIP or somebody na very important like in human trafficking cases nga, di ba, yung mga sinabi ko, that's the only time that we can report to the NBI. Okay? So that's the meaning of the authority in here. So suicide, that is reportable. So, unless nag-sign sila ng waiver with the PNP SOCO, okay? So that has happened before. Inconspicuous injuries. If you find some injury pertaining to physical abuse, okay? So you think that this is uh, not a post-mortem bruise. May mga bruises siya na mukhang binubugbog. Yung elderly, you may suspect abuse or neglect and report it to the PNP. Okay? So that's what this slide says. Beware of common complications that may cause us to overlook and fail to report the actual underlying cause of death. And let's go. Next. Sepsis. Okay? Patient has sepsis. Look for the cause of the sepsis. Is it due to UTI? You write down UTI. Is it due to a decubitus ulcer? You write it down. Decubitus ulcer. You can find that a lot of elderly has this, especially if the disease was obese, okay, or suffering from what do you call this? A debilitating disease like a stroke. Okay, so they are usually having decubitus ulcers. To find this, you have to really uh, rotate the patient. Okay, look at the look at the cadaver, the body. Okay, to find these ulcers. So pneumonia. Okay, find a better one if it's uh, pulmonary or cardiac disease or a cardiovascular accident instead of writing down a cardiovascular accident. Okay, or writing down pulmonary or cardiac disease. Okay. The cubitus ulcer, yeah, I keep saying that. Debilitating neurologic or systemic disease. Dementia, yes, okay. Reporting requirements for the death of women in childbearing versus the elderly. So, undetermined natural cause, presumed or probable is acceptable pagdating sa elderly. Okay? Rule out foul play pagdating sa elderly. Report not report not the complications but the more significant underlying or actual cause for the undetermined cause of death. So this is ano lang. Because this is a DOH slide. This is why I changed it. I tried to change the slide because they do not look good. So this is what it actually looks like. So uh, they were trying to uh, differentiate how we write it in women and children, childbearing age, and then the elderly. Dito is childbearing age. Ganito tayo magsulat. Pagdating sa elderly, this is how we write it down. We can write down undetermined natural cause. We can write down presumed or probable, but not in the women in childbearing age. We don't rule out foul play pagka women of childbearing age. But if it's a reportable disease, you can report the disease. So the list of the reportable disease is on the previous module. Okay, so next. Death from infection. So here it is. So yung imbis na septicemia, imbis na sepsis, you have to write down the body site. Left foot, katulad nung kanina dun sa ano, gangrene, diabetic, foot, okay? Left, okay? Laterality, manifestation, causative agent if unknown. So, diabetic foot, left with gangrene, cause unknown. Pwede yun. Source and route of infection. Food poisoning, if it's food poisoning, contaminated blood product, hospital or community acquired infection. You can write that down on a single line. So next, report the underlying disease that may have suppressed the patient's immunity and made him susceptible to the fatal infection. We're going to go for the examples. So it was identified that it is a pneumocystis hiruveci. I think that I pronounced that correctly. Pneumocystis hiruveci, pneumonia. Okay, identify mo, it's a pneumocystis. So you're going to think, oh God, that this is an immunocompromised patient. It's going to take a lot to ask kung meron bang AIDS yung patient doon sa may surviving member. Because most of the surviving member, either one, do not know that the patient has AIDS, or um, hiding it. Okay, so he's hiding it to you. He's hiding it because he promised the deceased that you will not tell anybody. Unfortunately, we need to write it down. Okay, kaya mahirap. It's hard for you to elicit this. So I keep asking in triplicates. Okay, so that's one of the. Once you ask a very um, personal question, okay, that most people would possibly be offended. Okay, so like nagkaroon ba ng AIDS or HIV infection yung pasyente? So did the patient have HIV AIDS or was diagnosed? You ask them three times. And if it's changing every time, usually on the third, or even if you try on the fourth, the relative will usually say, yes, patient has HIV and AIDS. This is something I've learned. I think this is ano ba yan? Tom Robbins, Anthony Robbins, Tony Robbins, way. Okay, so this is you ask it three times. It changes every time. You find that the answer will change every time. So that's one of the no, just so you don't need to ask for possible na ano tawag na to, which could be embarrassing for the relative to answer. Okay, so just ask it straight out. Did the patient have HIV/AIDS? And then you're going to tell them, I'm going to ask again, did the patient have HIV/AIDS? So one last time, did the patient have HIV/AIDS? And then if you find that it's changing every time, you're going to get to the yes part. Okay, and then you're going to ask them how long. Okay, so you put that there, months, 10 years. Okay, so HIV infection, AIDS. Okay, HIV and AIDS are the only, and COVID-19 are the only, like I said on the previous module, the only ones that gets abbreviated, because if you write down acquired immunodeficiency syndrome on the line, you will fill up the whole line up to the interval. So HIV then, if you and COVID-19, if you fill that up without the abbreviation, you're going to waste the whole line. Okay, just writing just the name. Okay, so those are acceptable abbreviation. Others, you do not place that on the medical certificate. Next, death from infection. Accepted as an underlying cause of death, except when due to conditions requiring blood transfusion. Okay, hemophilia and anemia. Major injuries. Surgeries, drug addictions. If this is the ano kasi are the um cause of death of the patient, HIV infections become the significant lang. Pupunta lang siya sa may significant. Okay, major injuries. There is a up and coming na slide for pagdating sa major injuries pala. Surgeries pa. Surgeries. There's an upcoming slide for therapeutic ano pa, therapeutic deaths. Okay, yung mga therapeutic complications. Okay, so yan. If the death of if the death of the patient is due to this, you write that on the top, and then other significant lung C, HIV infection. But if the healthcare associated infection contributed to death, it should be reported in part one. Then include all conditions in sequence of events back to the original disease being treated. Okay, wait, no, yeah. Facility acquired Pseudomonas pneumonia. This is their slide, man. This is their slide. I did not um, tamper on this one. Okay, so they place a text box saying immediate cause facility acquired Pseudomonas pneumonia, or you can be written as hospital acquired Pseudomonas pneumonia. Okay, necrotizing fasciitis presumed Staphylococcus of the left leg and psoriasis vulgaris of the left leg as the underlying cause. So in here you have three types. Okay, so you have infection in the lungs, infection in the left leg, both in the soft tissues and in the skin. Okay, so you place that there, all three, but they do not have the same onset. Okay, so pagka nakita mo yung onset is arranged not in the seriousness, okay, but in the interval po. So it is known that the pneumonia killed the patient 5 days, and it was identified 5 days prior to the demise or the death. So necrotizing fasciitis, another one that contributed 7 days before na identify ito, and then the psoriasis vulgaris of the left leg was identified years na, so that could be placed as the underlying cause. Okay, so that's the explanation for this one. Dun, dun, dun. And then include all conditions in sequence of events back to the original disease being treated. Okay, next. How long have I streamed this thing? Oh dear, 1 hour 18 already. We're not even in half yet. Next, we're taking my time. I'm taking my time. Okay, so this one is important. COVID-19. If I'm gonna give away a quiz, this is important because this came straight uh, as an email, as a memo. This came straight to all of us practicing during the pandemic. Okay, so AO number 2020-0013A was nung time na to, it was still not yet called COVID-19. It was called NCOV. Okay, but it was eventually changed to COVID-19. So confirmed case with or without clinical manifestation and laboratory confirmed for COVID-19 at the subnational. So this was always on the every memo at the sub or the national reference laboratory and or licensed COVID-19 testing laboratory or using antigen tests in areas with outbreak or in remote settings where RT-PCR test is not immediately available. This is the definition for confirmed case. So that's why on module 1 I showed you COVID-19 virus identified and COVID-19 virus not identified. Those that were confirmed via the ano do you call this RT-PCR by the national or subnational reference laboratory, you get it as COVID-19 identified, so confirmed case. If it's an antigen test, okay, there's no probable anymore. It's either confirmed or not confirmed. But in the AO 2020-0013, they already call this as a confirmed case. So, immediate cause, look, just COVID-19, severe pneumonia. What do you write here? Nothing. Okay. If there is a comorbidity, you write it down here. Okay. Ta-da. This is how you write down sa my COVID-19. Ayan, ayan. So, previous, this one can be placed here. Okay? Pwede siyang mag-move dito if you can identify an additional um, comorbidity ng severe pneumonia, COVID-19. So next, boom. Acute myocardial infarction. Was that caused by the pneumonia? Yes. So, nakalagay si probably COVID-19. Severe yung pneumonia niya during the pandemic. Okay. So, this is COVID-19 virus not identified. But you can place probable or presumed COVID-19. Okay. And then in the front, acute myocardial infarction, yes. So, this is one of the things na early on we met na in the working population, uh, patient could have acute myocardial infarction. Okay, in the elderly, it's usually diarrhea. Okay, so yeah, due to pneumonia from COVID-19. Okay, so because of our immunocompromise against the new virus. Okay, next, yeah, it's potential complications. So it's in here. This is one of the reiterations, one of the types that were given to us that early on during the COVID-19, it is found that COVID-19 can affect any system. Okay, it can cause stroke, meningitis, encephalitis. Okay, it can cause liver failure. It can cause kidney injury. It can cause but the last na explained is the cytokine storm. Okay, so you're going to find that on the YouTube. It was a lot. There was a lot of doctors, infectious disease experts, pathophysiologists, trying to explain the cytokine storm a lot. Okay, to us, the immunocompromised may be, may be overwhelming, causing a secondary infection. So it's still COVID-19. Okay, during the time of the pandemic, this is the uh, causes. Okay, so MI types 1 and 2, even MI in vaccines as an adverse effect in vaccines like COVID-19. So this is something I still have to find out why. Okay, but it can cause. Okay, it could be due to viral myocarditis. But the mechanisms not so much clear, but these are almost every organ system po. ARDS, pneumonia, dyspnea. Okay? Hindi nakalagay. Si diarrhea. Okay? Si gastroenteritis can be done. Can also be found. Mo Most of our early fatalities with elderlies dito po sa may Olongapo City, the only symptom was diarrhea. Okay, severe diarrhea, complicating the with this is usually acute gastroenteritis with severe dehydration. They die of dehydration. So isa yon sa mga nakikita namin na COVID-19. It's not here. Okay? Pero meron pang mga magaganda pang mga infographics that we were able to use to explain to patients and relatives that kasi darating yung patient with chest pain lang. Okay? May mga dumating na mga patient na for OR, clean patients supposedly, but requirement sa OR that the patient has to undergo RT-PCR. Nalaman meron siyang COVID. Possible na hospital acquired? Yes. Walang sakit but then developed heart failure or MI habang nandoon sa ano po. So you have to explain. This is part of the complications of COVID-19. So next, reporting requirements. So from infections, we're going to neoplasia now. So it's almost how the same with cancer. So always place the body site in laterality. Is it the foot, left or right? You have to put it there. Causative agent if known or unknown cause. So you place there unknown cause. Okay, cause unknown or unknown cause. Source and route of infection. Underlying immunosuppressive disease as an UCOD, undetermined cause of death. Okay, health facility related. Am I saying the right thing? Underlying cause of death. So underlying cause of death. UCOD is underlying cause of death. Okay, so I have to correct myself there. UCOD is underlying cause of death because I'm really tired. Okay, sunod. Yeah, this week is very hectic. It's a source and route of infection and health facility related. Okay, if health facility related, if it's hospital related, you place it there. Next, So we're transitioning kasi to depth from neoplasm. Depth from neoplasm, you're going to find it specific site and laterality. You still place specific site and laterality. The primary site must be stated even if it has long been removed before death. Ano ibig sabihin nun? What does that mean? Breast CA, nag-undergo na ng bilateral mastectomy, but the patient died of a liver metastasis. Okay, you still have to write primary and breast. Okay, primary is the breast cancer. Okay, so if unknown, you write primary unknown. State cancer spread as secondary cancer, secondary neoplasm, or secondary cancer, and we don't put metastasis na. Okay, so examples. We're going to go fast so you can see the examples pagkadating sa neoplasm. So behavior of the tumor, is it a benign or malignant? So patient can die from benign tumors due to obstructive mga pathophysiology. Okay. So histologic if known or unknown cause. Okay, so if there is a histopath, it's important that we place it there. When a secondary growth contributed to death, state the site of secondary growth as due to the site of the primary growth. So we're going to look. And okay, but secondary carcinoma of the liver, 1 year. Okay, so yan sinabi ko, pwede ka maglagay ng year. 1 year yung secondary carcinoma of the liver. And then primary adenocarcinoma of the left breast 3 years ago. Okay? Yan lang. Okay? Simple. So, screenshot this. Okay? Pagkadating sa cancer, maraming sinasabi yung mga relatives, dinala ko si patient sa naninilaw na siya. Yan, secondary carcinoma of the liver. Naninilaw na siya. Or, they are usually going to tell you, ay, severe abdominal pain. We had to put him in the ER. Okay? So, that's a usual presentation. But we're not going to place that there. Okay? We're not going to place obstructive, the liver failure. Okay? They do not help. Okay? In the, ano po, kasi I've seen one of these things and yung cancer na metastatic cancer, stage 4 was placed here. But the cause of death is the cancer. Okay? So nilagay lahat. Acute renal failure, acute liver failure, acute hepatic failure, electrolyte imbalance pa, secondary to it's all there na it's already encompassing the interval lines, okay? And wala, they wrote the whole chart, okay? Sana makita ko nga, meron ako mga examples pa. I was asking if I could take pictures, but you know, those are how they still write it today. And this is how easy it is na lang. Okay, it's easier uh, to write down, especially pag death from neoplasm. So, pwede mo ilagay secondary carcinoma. If you write secondary carcinoma, there has to be the primary adenocarcinoma. So, previous that. That's what it means here. Secondary growth contributed to that. State the site of the secondary growth as due to the site of the primary growth. Okay, so place that. Okay, so if primary is unknown, you write primary unknown. Okay, next, please, next. So yun po yung mga sinabi ko lang po. Hey, 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 am I still... No, I'm not in the slides. I'm placing myself in the requirements of YouTube. So primary unknown, secondary adenocarcinoma of the liver, 1 year. So usually it's not a primary adenocarcinoma of the liver if patient is not ano to? Hepatitis B patient. Pwede ka rin maglagay nun. Usually hepatitis B ang cause ng primary adenocarcinoma of the liver. So pagka primary adenocarcinoma of the liver, hepatitis B infection here, kung na-identify that the patient is hepatitis B. Otherwise, if hindi naman siya hepatitis B, okay, or wala naman liver cirrhosis noted prior, okay. You can put secondary adenocarcinoma of the liver. The tumor could have been due to another um, neoplasm, which could be years na, okay. So na hindi na identify. Doon sa my patient, okay, so you can put that primary unknown. So we keep going back to my slides previously para mapakita kasi it's very hard to explain unless makita nyo po unless you can see actual, the actual examples po. Okay, so this was the ones that I'm referring to bandalas. The patient had cancer. Okay, yun na lang po ang lalagay natin po. Yun lang sinasabi ko sa relative. So reporting requirements for death from infection versus neoplasm. So ayan po, yun. Kaya po inisa-isa po kanina kasi para i-compare natin na halos the same. So each one will be site and laterality will be placed primary or secondary infection and versus primary and secondary growth. Okay, so causative agent or cause unknown, you can also place histologic cause or cause unknown in neoplasms. Disease suppressing immunity is reported as the cause of infection. Okay, so if it's HIV, okay, bakit nagkaroon ng spread ng infection? Diabetes, okay, you can put that as the UCOD, so underlying cause of death. Behavior of the tumor, benign or was this staged, okay, nabigay ba yung stage 3 po ba, stage 2 po ba, okay, report, yun lang, may mga, dito, sa infection, that is, unique, report the route of infection, or community or health facility related. Okay, so we have examples now before. Yeah, I'm not gonna go back there. Death involving external injuries. Ito na po, yung magkukwento. Okay? May kwento na mailalagay dun sa my medical certificates. We're gonna put storylines na sa medical certificates kasi cause of death. Injuries are usually physical, thermal, electrical, or chemical in nature that cause trauma. Okay? External injuries, not natural death. Okay? Many are reportable deaths that require autopsy. So if you have that, refer. Okay? Where do you refer? PNP Soho. Okay? Sa amin sa Olonga po City is the PNP Soho. We refer them to their offices. If the PNP Soho offered the waiver, that's when you write down death involving external injuries. Okay? So that's from experience. Fatal derangement is the immediate cause. Okay, ito po ay, hindi po ito example. Okay, this is the guideline. So the guideline in letter A is immediate cause. You've placed the fatal derangement. Okay, fractured skull. Dun sa may ano natin, di ba? Fractured skull. That's the fatal derangement. Was it an open fracture or a closed fracture? You're gonna place that in there. Okay, of the skull, closed. Skull fracture closed. Okay, due to blunt trauma. Open fracture due to the vehicular accident. Depende yan kung ano po yung findings. Body trauma. Injury or damage to body organs or its functions. So, yung kanina, yung ating mga first example, it's very hard to go back to those slides. Okay, so, yung mga sinabi ko po. You can place injury or damage here in the letter B because the letter C or the underlying cause will be what caused the trauma. If it's an accident, magdodrawing ka. If it's a fall, diba? If it's a fall, you're going to place it there. Ano to? A patient fell from a banana tree. That was the example given to us, which kept us laughing during our training of training, which is a good one, good way para po memorize namin that you write the story on the underlying cause. Okay? Why you write the story? Because this is going to be possible sa statistics nga po. Okay? It could be that there is a mass climbing of trees, dun sa may ano po. Or ang pinakamadalas ay yung pong vehicular accident. So, it could be that you can place the vehicle, okay? Para lang po masama sa statistics po. Kasi pagka nakikita diyan na pagka nababangga ng certain na car or anything po, or what street, yan na po, si place of occurrence, what street. That street could be, there could be something inherent in that avenue, street, or anywhere, that place. Okay, is it in the home or in the factory setting? And then if madalas statistically significant, you look into it. Okay, so everything is decision making. Okay, ng mga decision makers. So it could be the mayor or the president of the Philippines or the secretary of health or even NGO or civic organizations that would like to use those statistics to base their activities. Okay? So, yun po yung mga importante. Hindi yung blindly na lang na cause ng intervention na hindi naman kailangan ng community. Okay, so type of vehicle. So when it's vehicular accident, you place a type of vehicle. Is it a truck? Okay. Is it a bulldozer? Was it in a train? Because if it happens too often, it becomes statistically significant. Okay, it's a motorcycle. So how are we going to say that motorcycle injuries are deadly? Are rampant, okay, na nag-increase na because of certain interventions. Okay, so we're gonna place the type of vehicle. Indicate whether the deceased was the driver, the passenger, or the pedestrian. So in the past two modules, you hear me saying driver, passenger, or pedestrian. Specify the type of gun. Okay, was it a handgun? If nabaril yung pasyente, was it a hunting rifle, etc. If it was known. Okay, so usually in a terrorist attack or in a shootout, okay, there is you can identify. The relative cannot identify what type of gun unless nag-process yung PNP SOCO. Okay, so that's why the PNP SOCO is usually the best ones to write down. Okay, yung medical legal na investigation, and they write it lagay po. No? Pero pag ikaw maglalagay, decide the waiver, you place this thing in there.
Next, death involving external injury. Yan she fell off a ladder while painting the house. The underlying cause of death, you write it down. Brief, specific, and clear description on how the injury occurred. Ito na po yun, yung sa mga sinasabi ko kanina, yung mga maternal causes that could be accidental. I keep referring to the fell off a banana tree because it was a running joke, diba? Driver of car, ran off roadway, or cross the sidewalk. So, pwede yun. Okay? Or yeah, or activity in which the deceased was engaged during the injury. Was he playing sports? Was he working at the house? Drinking in a bar? Okay, or a semi factory? Okay, so this becomes statistically significant kasi if it is like pagka nagkakaroon tayo ng drinking in a bar, madami masyadong drinking in a bar and fighting, okay, because of alcohol problems, okay, these things you want to address dahil paano ma-address kung hindi natin siya nare-report ng tama. Okay, so we have to write it correctly so that it becomes statistically significant for the decision makers. So medical certificate, immediate cause, subarachnoid hemorrhage. So there are three types of hemorrhage sa mga pagdating sa closed wound of the head. Okay, so subarachnoid is one of them. Minutes, blunt trauma of the head. Okay, so antecedent cause. Going back, go back, go back. Why is that blunt trauma? No. Why is that blunt? Yung pong formula. The formula. This is the body trauma. The body trauma was blunt force trauma. Blunt trauma. So yun po. Kaya yun nakalagay dyan. Blunt trauma minutes. And then yung kwento, si underlying cause of that. UCOD. Pedestrian on foot in collision with a moving motorbike. If you put it like that, this becomes statistically significant po. Sa mga motorcycles po, they have to, para magkaroon po ng basis for intervention. Kasi kapag yan nakita ni LTO or ng local na traffic services po, they can have some basis na po. Oh, here, we have people dying because they were hit by a motorcycle. Okay, maybe we can do something pagdating sa mga motorcycle. Kasi gagastos yun ng pera. Okay? Gagastos yun ng pera ng bayan. It's all the government's money that will be used. How are we going to use that? You use the statistics. Okay? If it's not statistically significant, why would we have an intervention for motorcycle drivers if the locality, mababait naman pala yung mga motorcycle drivers? Okay? So that's why that's important. Okay? Tapos, malalaman natin yung street. Was there a problem in that street? Okay, see if the name of the street is Makabayan Avenue, maybe there's a problem in Makabayan Avenue. Okay, that LTO or the local traffic may have to uh, do intervention. Okay, so baka hindi well lighted yung street or streets doon. So this will involve money that will benefit the living. Okay? So that's why it's important to write this down for statistical purposes. Manner of death, accident. So if you place it there, accident. Was an autopsy done? No, because you're actually filling this up in the front. If the autopsy was done, yes. So usually the autopsy is done by a medical legal professional. The medical certificate, cause of death will be filled up by the in the back, okay, by the medical legal. Okay, you're not supposed to need to put this in here. Kasi meron dumating sa akin, nagkaroon ng mistake. I was able to write all of this down and then I realized, wait, this is a reportable case. This has to be reported to the NBI. And then the surviving relatives will then tell me, yes, yeah, we were there. We just want to fill up the front lung, but somebody already filled up the back portion. Oh my God. So I found that the back portion has been filled up. So this it became a lesson for me to flip because sometimes you are so busy at the moment, just like me today. Busy at the moment, you keep writing it down, checking it, then you forgot the simple lang na gesture that this certificate is already done. May ginawa na yan ng ano, autopsy pala si patient. So, yes, sa autopsy, and then at the back, the medical legal will have to put his findings sa autopsy. So next, that involving external injuries, intra-abdominal hemorrhage. So it's nice to know the mechanism po dito sa mga external causes. And then antecedent cause, you can write two. Laceration of the liver due to blunt force trauma of the abdomen. Okay, sa binubog. Pwede. Or ginamitan ng which cause intra-abdominal hemorrhage? Pwede. If it is due to a homicide. But in here, underlying cause, UCOD is just a fall from a tree while picking mangoes. Okay, so you're going to put that there. Interval can be the same, 2 hours, 2 hours, 2 hours, 2 hours. Okay, so it's an accident, it's not a suicide. So where did this occur? At the home. Okay, so mango trees at home could be statistically significant. Okay, so autopsy, no. Okay, because you're filling up the front. Next, traumatic brain injury. Somebody was shot on the head. Okay, so when somebody got shot on the head, you look for this one. Oh, it's not a suicide. Somebody shot him. Okay, legal intervention. Okay, so that's also common. Okay, not so common during the pandemic and after the pandemic. It was common in Olongapo before the pandemic. Okay, we have because Olongapeños are what do you call this? Disciplined. A lot of Filipinos are disciplined. We do not have violence in Olongapo, especially even during ano pa, where there's no gun violence or any kind of types of violence sa Olongapo. We are usually visited by ayun nga, mga masasamang loob galing sa ibang lugar because we get to catch them. That's the problem lang. That's the problem of those who are planning who did ano na nahuhuli sila. They're usually caught because a lot of uh, the discipline comes from the American way of life. Here dito sa may Olongapo. Natuturuan nila na this should be reported. So pagka may mga nambarel, like this one, madali. Hindi kailangan ng CCTV to find out the perpetrator. Most of the time, they get reported by other people. They already know. The 911 is operational far before the national 911. Kasi gumagawa ng paraan para mag-report. Okay, so, yan po. 30 minutes, 30 minutes, 30 minutes, legal intervention head. Hanggang discharge. So, next. So, this one is very important po. If nag-sign ng waiver, ayaw pa-sign sa PNP Soho, ayaw pa ano. Okay? I always convince the patients po. Okay? Because once na there is a problem here, or you wrote down this thing in here, you're going to be called on the stand. Pagka nahuli yung perpetrator, like in here, legal intervention, meron palang foul play, meron palang ulterior motive po yung police. Okay, bakit yung binaril? Okay, so this is something na could come up. Okay, and you'll be called to the stand. Okay, kasi ikaw po ang nagsulat. Now, another one, right intrathoracic hemorrhage. So you place the laterality, the uh, laterality location, okay? Tapos yung manner of death, hemorrhage, right intrathoracic hemorrhage. But you put the antecedent cause, Transection of the right subclavian artery due to a stab wound. So this is a presumed homicide po. Alleged homicide. Presumed homicide. Presumed and probable ang pinapalagay sa atin. Okay? So not alleged nga pala. Sorry, sorry. Bad example there. So contact with sharp object in the unknown, di ba? Hindi nakuha yung ano the item that caused the death. Okay. So contact with sharp object. Autopsy, no, because you're filling this up. It should be filled up. This is a reportable. So napaka-importante po na na-report ito. Next. Previous, wait. This is gunshot discharge. This is not the same. I remember this one. This is not the same as the previous one. Okay, because this is actually suicide. The patient had two suicidal attempts na because the patient has terminal colon cancer. So see other significant, this is an example of other significant conditions contributing to death. Okay, nagpakamatay na siya dahil intentional, it's a homicide or suicide. Intentional, it's a homicide or suicide, and that's reportable. So the medical examiner or coroner, okay? So wala pa kaming coroner, so I have no idea. As a medical examiner. So combinations of the above variable or the undetermined. So kasi sa ibang bansa ito no? So this is 1997 cause of death statement specification, natural and non-natural deaths. So this is just an example of how it is written some medical textbooks of how to identify uh, yung manner of death. If is it natural, homicide, or variable or undetermined. If uncertain about the intent of the manner of death, you will report undetermined cause of death. Okay? Instead of speculating because those speculations that may be baseless may find themselves in statistics, and the decision makers may be found to fund things that are not needed by the community. So another one, handgun discharge, terminal colon cancer, manner of death undetermined. You do not know if this is a homicide or a suicide. Okay, baka mayaman ito eh. Ang isang possible na air, di ba? Binaril. Pwedeng binaril. Hindi mo alam. Okay? Pero the patient also has terminal colon cancer, so you don't know if it's a suicide. So if you don't know, you place undetermined. Because the judge will ask you, why did you place undetermined in the manner of death? Because at the time, I was unaware of whether it was a suicide or a homicide. So that's a good answer. Instead of why did you place there that this patient is legal intervention. So maraming questions pa diyan. Nasasagutin mo pa okay why you are basing that as a homicide or a suicide. Okay, if you don't know, write it down. Undetermined. Procedural death. So this is one I've been teasing. Okay, because this one is very hard to do. So kasi it may entail malpractice. Okay? And we do not want our fellow doctors to have unnecessary na ano po, okay, na unnecessary na lawsuits. So we're going to go there, death known or suspected as having resulted completely or partly from a procedure. So he wrote down here procedure or therapeutic. Ayan. From a procedure, was it diagnostic, therapeutic, operative, or anesthetic? So hindi na siya surgery. Okay? It can be therapeutic, like aspirin therapy, aspirin chemotherapy ang tawag. So it can be chemotherapy. Okay? Or diagnostic. A patient was got, so namatay, nag-appendectomy, namatay, so namatay, nag-appendectomy, namatay after a few days, okay, or nasa bahay na, okay? And if you're going to write down procedural deaths, this can lead to negligence, mapapaisip ng negligence, and can cause malpractice suits. Na hindi naman actually malpractice. So, many procedural deaths do not actually involve negligence, mistake, or culpability. So, example lang. Okay, so example lang is an elderly patient requiring surgery. So, marami or a terminal patient requiring surgery. Sa namatay. Okay, so when it's involves a procedure like that, yeah, dental extraction or sa may uh, post-op tapos namatay, especially in terminal patients po, o kaya mga specific na conditions po. Ang in-offer yung mga procedure na yan as an alternative. Okay? Kasi kapag hindi in-offer ng doctor dun sa patient, the patient may die from appendectomy. Okay? Or may die from dental injury kundi pa rin nabunutan ng ngipin po. Okay? They could die from the infection if the surgery was or the procedure was not done. Pero the procedure kaya po we get the waiver, we get their consent. Okay, we get their consent done prior to the procedure kasi this has to be explained. Pagka ginawa yung procedure, there's always the risk. Okay, na magkaroon ng post-op, pre-op, during op na death. There's always that risk, even in normal patients na yung mga hindi naman terminally ill or elderly or anything. That can happen then. So, it's the same then pagdating din sa mga patients who are terminally ill or merong comorbidity, mas mataas yung risk po ng mga ganon. Pagka pumayag kasi dun lang yon. So, it's not everything malalaman na, ay, nag-chemotherapy, namatay. Okay? Patient is undergoing chemotherapy to prolong his life. But unfortunately, the chemotherapy may cause unwanted side effects or can cause an early death. Okay? So yun naman ay hindi naman po mistake, hindi negligence or there's no accountability doon sa po kasi it's a shared accountability pagdating po sa mga consented actions po. Okay? So, pero it's still a procedural death and this is how you're supposed to write it down. So major concerns about wording and the format of the report may foster litigation, unnecessarily implicate or alienate a physician, other person, or agency. Okay, so may mga examples ng nito sa mga po na um, na namatay, di ba? Anesthesia. After the anesthesia, namamatay. Okay? Tapos it was found out that it was poisoning pala. Doon sa may, so this one is a fairly recent this happened in the United States nga eh. So, it was found out that the patients were dying from tainted IV lines. Okay? Pero if the wording in the both the surgeon or the anesthesiologist may be implicated in something na hindi naman sila may kasalanan po. Okay? So it may alarm family members or survivors. So that's important on how you place the wording. Okay? Especially sa mga kaka-opera lang. Tapos nagkaroon po ng embolism. Next. Problems may occur, yeah, if the COD is oversimplified also or omits known complications, they think that you are in cahoots with the surgeon or anesthesiologist that they want to sue. Okay, there's always the anger stage, always po, in the 5 stages of grief. So they're always in denial. There are places of denial and anger is there, and then they want to blame other people, okay, even though wala naman kailangan ma-blame. Okay, so this is something na tapos ilalagay it's so simple lang nilagay doon sa jellyfish attack. Okay, so what happened? Nag-undergo ng, there was a therapeutic, ano, ginawa doon sa may bata. Kaya namatay sa ICU. The patient died in the ICU. So, yun po. Yan, mga recent po. If the cause of death is oversimplified or omits known complications, the mother might think, hey, somebody's trying to hide some things from me. I saw my daughter have his tooth uh, removed because of the intubation. So may mga ganun. So if we are oversimplifying things naman, it will still inhibit pa rin yung mga ano po. It may alienate physician. Okay, so may be perceived as an attempt to conceal facts or cover up a problem. Next. Wala pa rin sa ano, no? Based on documented or reasonably probable facts, state the truth to the best of one's knowledge. Okay, we're still live and running for 2 hours now. So that's why I'm tired. Sorry, let's keep going. Okay, so based on documented or reasonably probable facts, state the truth to the best of one's knowledge. You can be called upon what you write on the death certificate sa stand yung ano pagka nagkaroon ng mga litigations. So peri-procedural deaths to ensure proper adding coding, specified appropriate category, and observe the proper format. Ito na, please. Yes, okay. So appropriate peri-procedural death categories. So it can happen in or around a diagnostic, an anesthetic, or therapeutic or operative. It can happen intra or during the therapy or procedure or post or after po. Next. Yan, example na. Para makita lang po ninyo. Kasi dito sa examples po, ito yung, this is the ones that you can keep. You can print, you can keep it, you can put it in your tablet. Para if in case that you meet a chance to write down cause of death, you use this as the format. Okay, so you place the antecedent cause as the procedure. So intra operative complication of colectomy. So ito yung nangyari sa kanya, yung colectomy po. So what is the underlying cause? What made the both the patient and the surgeon, okay, do the colectomy? It was the primary adenocarcinoma of the colon. So since we're discussing this, it's known na that it's due to processed foods. Okay, so mga mahilig po sa mga canned goods, sa yung mga instant noodles. So it can cause primary adenocarcinoma of the colon. Or you can have it, yeah, genetics. So acute myocardial infarction can be the immediate cause po. Okay, and then intraoperative complication of colectomy. It is can also be I think this is PE. PE can also happen, especially if it's hours, pulmonary embolism. It could happen in hours po after the ano po. So after isa yun sa mga ina minomonitor ng mga anesthesiologists yung hypercoagulability after an operation po. Okay, so it can cause acute myocardial infarction, a possible na severe stroke, or a pulmonary embolism. So pulmonary embolism yung nakikita ko sa meron yung hirap huminga. So other significant contributions contributing to death, of course, madalas pagka nalagay acute myocardial infarction dahil the patient is known to have atherosclerotic coronary heart disease. So, what is that? I explain that to my patients to being able to prevent early death po. Okay, next. Ayan. The structure and format used in writing the cause of death statements depends on the manner of the death. Was it natural or accidental? So, is this natural or accidental? This is natural death. It's not, tama ba? This is accidental. Okay, so okay. Patient is dying even before the procedure, or the patient would have died without the procedure. That's natural. Okay, so the patient has cancer. already. So he's dying already. He underwent the operation. Next, so the patient would have died without the procedure. Okay, because of blocking the intestines, di ba? If you cannot, you will have septicemia and then a lot of complications po. So next, ayan, patient's death is imminent. Patient will die from the disease and would occur if we do not do the procedure. So the procedure is usually emergency or life-saving procedure. So yun, colectomy is a life-saving procedure. It can prolong the life of the mga ano po. Okay, so pwede pong ilagay yan dyan. So underlying cause is the medical condition or the reason for doing the procedure. Next. So can place the appendicitis na, di ba? Appendectomy, intraoperative or post-operative due to an appendectomy can be placed in here, di ba? Next, peritonitis, presumed E. coli because of bile leakage, a post-operative complication of cholecystectomy. Hindi natahi ng maayos. Could be, you know. So, pero, it's still a complication that can happen to a lot of surgeons na nag-operate po ng patient po. So, yan, cholecystectomy. The patient has acute cholecystitis because that's the indication for doing emergency surgery. Okay, so acute cholecystitis. Next. Natural pre-procedural death. Elderly patient with refractory congestive heart failure requiring high dose of digoxin to maintain effective cardiac output, but died of toxicity from digoxin. So the patient was given uh, digoxin therapy already. So as long as you're giving medicine and then they died, it's an intratherapeutic or peritherapeutic complication of the digoxin of the therapy of the antibiotic therapy. Can be antibiotic, it can be aspirin, it can be digoxin or any therapeutic ano ba. This is how you place it na peritherapeutic complication of digoxin therapy. When did this happen? A year. Pwede yan 1 year. Okay? So what happened? Digoxin toxicity. So we've been some medical students, they are taught to memorize yung digoxin toxicity. Me, I already forgot this digoxin toxicity because this is seen mostly in the wards, in the ICU, which I do not anymore have patients at. Okay, so atherosclerotic coronary artery disease is the one reason why digoxin therapy was given in the first place. So namamatay na yung patient or the patient is already dying from atherosclerotic coronary heart disease or ischemic heart disease. So you can place that here. When did he have that? 3 years ago. How do you know that he's dying from that? Because there is already congestive heart failure. Why didn't you put congestive heart failure here? Because that is garbage code. Okay, so it's much better to just place atherosclerotic coronary heart disease instead of putting something like this. Okay, understood? Hopefully, do not have my students answering me. I wanted to do this face to face. Honestly, I do not. So this is already the 8th hour of the training. So that would not occur if there was no procedure. Okay, accidental pre-procedural death are those that are elective. Elective. So if elective cholecystectomy was offered to you, okay, so there and then you died, this is an accidental peri-procedural death. Use the split format. So what is the split format? So that by you can place that by external causes here. So place external causes, emergency room or something. Ito na. Ito na po yung split format po. So immediate cause will be the complication that caused the death. So the antecedent cause will be the procedure na. Okay, that caused the complication. Lang, pala, lang. And then underlying cause can be placed there. You can change this procedure to here if there are other things that you can find in here. And then the medical condition, which was the reason for the procedure, will be written in the other significant. So it gets clearer with the example. Okay po. Peritonitis probably Enterococcus fecalis. Okay, so may probably. The word probably can be used. Peritonitis probably Enterococcus fecalis. They probably had uh, previously seen this Enterococcus fecalis. So less than 2 days, na developed ng peritonitis. It happened because of a retained cotton ball in the peritoneum, which was identified 2 days ago. So it's a perioperative complication of the cholecystectomy 2 days ago. Chronic cholelithiasis is the condition contributing to the death. So back. This is a medical condition which was the reason for the procedure. Next, so having chronic cholelithiasis does not actually mean that you need to go undergo cholecystectomy. We offer cholecystectomy because of the cholecystitis. Uh, once there's a blockage, okay, the liver may suffer failure. Once the liver suffers failure, it can cause death. Okay, so kaya siya elective. Elective siya. Unless this is acute cholecystitis or what is much worse yung sa may liver failure. Kasi hindi ko na na-meet sa ano dati I'm really good at it, but now yeah, if it's acute cholecystitis, that's why you put the cholecystectomy. That's why cholecystectomy was advised to the patients. Place them here. This is the split. Okay? Nalalaman ngayon nung magbabasa that the patient was suffering from this disease. Okay? And then masasama na ngayon siya sa may what do you call this, statistics, okay, na, marami na tayong mga chronic cholelithiasis dito sa Pilipinas. Maybe we, dying from chronic cholecystitis, the cholelithiasis dito sa Pilipinas, maybe we can do something about their diet because this is due to the uh, mostly due to the ano po, cholesterolemia. Okay. So this is something na pagkadating sa mga interventions is important po pagka nakikita nila na statistically significant na ngayon yung mga chronic cholelithiasis, okay, deaths from cholelithiasis po. So nangyari lang yung death due to the complication of cholecystectomy. Next. Writing format. So natural, combine. Okay. Accidental, you split. You use the bottom part. Underlying cause is the medical condition. Sa natural. Okay. Because the patient is already dying. Pero namatay siya ng mas maaga pala nung inoperahan siya. Pero that doesn't mean that it is a medical legal case. Okay. Because again, patient is already dying. The consent is given to the doctor to operate, okay, by the patient. Okay, kaya po may mga signature yan bago po mag-undergo. So, accidental, split, the underlying cause is usually the procedure po. Okay? Not the medical condition. Next. 45-year-old patient known as an IV drug abuser with AIDS developed P. hiruvecchi pneumonia 3 days before confinement. On the second day, she became severely dyspneic, ultimately requiring extreme positive pressure ventilatory support. Patient developed bilateral pneumothorax during the night and died. So, it's already given bilateral pneumothorax. So, do you put extreme ventilatory pressure? No. Okay, it's complicated by the ventilatory support. You don't need to put the extreme positive pressure or if there's given ano pa ba yan? CPAP, PPAP, BPAP. Okay, you don't need to place those things. This is a complication of the ventilatory support due to the P. pneumonia. Because what do you call this? Binigyan siya, di ba? Okay, she became severely dyspneic. So, perotherapeutic complication. Binigyan siya ng nilagyan siya ng ventilator. Okay? Dahil meron siyang pyruvecin pneumonia. Due, nakalagay dito yung due to. Kasi we all know, like I said, pyruvecin pneumonia happens only on patients with AIDS. And I think the other one is aspergilloma. Okay? With people with AIDS. Okay, so yan, ay ilalagay mo pa rin si acquired immune deficiency syndrome. Kasi, okay, so, and then other significant conditions contributing to the death, you can put IV drug user. Though, of course, intravenous drug user instead of IV because we do not allow that, what do you call this? Abbreviations. Reporting requirements for death involving natural periprocedural versus accidental periprocedural. The procedure is always doon sa may antecedent. Sa underlying yung condition doon sa may natural periprocedural. If merong contributing, pwede, katulad niyan, smoking. Okay? Ano ba yung previous na? Intravenous drug use, pwede. Okay, ilalagay natin siya sa significant cause of death. Complication of the procedure happen dito sa immediate po. Pareho yan. Complication, procedure. But the condition is written here sa may condition requiring procedure. And then, doon sa may accidental, peri-procedural, we place perioperative, post-operative, and then intraoperative complication of the ano po, the procedure na. Wait. Ito, si retained cotton ball in the peritoneum. You can place that there. Students not to undergo because that is required na for the facilities to check paano natin check. Pero as ano doon mas it's more fun to get doon mas it's more fun to get that lecture. So I'll be probably not be uploading that tonight yung the other lecture po. Okay? Probably try to do it early in the morning. So, multiple causes. So, this is one of the errors. Missing time interval. So, nilalagay pa nila codes, pero you can place that as to doctor ganito. Maybe you can place, there's a missing time interval. So, abbreviations, the following abbreviations are not used according to AO 2020-008, that can only be used are the following, tatlo lang yon. So, illegible handwriting, we're going to discuss this doon sa my next na lecture. Okay? So, incorrect or clinically improbable chain of events leading to the death. Yun na. So, kung biglang naging 7 days immediate cause, 5 days dun sa may antecedent cause, mali. Okay? Pagka, you have to write it down sa may interval by the basis of interval. Phase condition entered in the lowest used line of part 1 cannot be an underlying cause. Line of part 1. Okay? Yung gumamit ng mga codes na hindi importante. Okay? Ah, external causes, manner, or place specified. So, you have to check. Okay? If it's not, you write a note. Balik yung ano po kasi. Yung ano po, kahit yung simpleng illegible handwriting, you cannot understand kung ano yung nakalagay doon. That is poor quality death certificate. It has to be returned. So neoplasm, site morphology, behavior specified. Okay, so if it does not follow that, you bring it back and then you write down neoplasm, site morphology, and behavior specified. Infection, no site or pathogen unknown, you can put that. Okay, but if no site, mas maganda. Laterality, left or right, is it community or hospital or facility acquired? Okay, kaya na nalagay facility acquired because nga, tulad ng sinabi ko yung mga dialysis, it's not actually the dialysis facility but there are specialty hospitals po. So, kaya po nalalagay nila facility acquired po. So, immunosuppressive diseases, underlying cause of death, hindi nakalagay. Okay, yung pong AIDS was not placed. Please place it po. Ayan. So, ill-defined cause of death on any line. And then skipping lines. Those are going to be presenting on the next module po. Okay, that's why it's in here. It's like a teaser. So next, okay, so this is the last. Okay, so let no death be in vain. Accomplish the correct death certificates. So no more garbage code, please. So this is the message po of the DOH po. Pagdating po kasi doon, the garbage codes will not be the ano po, final legacy of the patient po. So i- placing the whole chart in the causes of death, that's not something na makakatulong po to those who are still living. Okay? If you give the proper uh, death, a cause of death dun sa may death certificates, those his life, the patient's life, will mean something to those who are alive today. Okay? So this is just a joke nakalagay lang dito say I'd like a second opinion. So this is just a joke, but it's important. And you can mean some the death of another patient can mean something. Because firefighter tradition in Virginia Beach, um, eh, katulad yun, yung sa legacy. Okay, pagka namatay, line of duty death. If the firefighter dies from anything, okay, hindi not necessarily from the fire, basta as long as he's on duty. So if the patient died from myocardial infarction, everybody in the fire service knows about it para ma-remind. Okay, so nagkakaroon kami ng line of duty death reading nung nandoon pa ako sa Virginia Beach, and then they will say that this patient that we have a firefighter named this, and he died of a myocardial infarction because of an atherosclerotic heart disease. So why do they do the line of the duty death reading? Because to emphasize not just to the trainees to the but also to other ano na merong uh, risk factor ang mga firefighters na walang exercise to do this. Ang madalas ngayon, as I was informed by somebody from my academy, okay, firefighter academy sa Virginia Beach, I was informed that they are having like LODDs or line of duty deaths na puro sunod-sunod na cancer. Okay, so it is known that in firefighters, the common cause of death sa mga uh, firefighters who have reached ano um, for males for males is testicular cancer, okay, and then other forms of cancer comes second, okay, dun sa may ano, so cancer is very common kasi doon sa retained carcinogens, anything burned, especially with the materials now sa tawag kasi na doon legacy materials. Okay, yung mga wood, wool, yung mga legacy materials, there's no problem with that. Pero pagdating dito sa mga sofas natin today, there are synthetic fibers na that can cause carcinogens when they burn. Okay, so yun yung isa sa ano, and they are exposed to those things, especially during what we call the overhaul. Pagka nag Pagka naglilinis na, even the firefighters do yung paglilinis after the fire. Okay, so we were trained to do that. So, yun, their deaths, the causes of deaths are read to every fire service to remind the ano. So may legacy, namamatay ka, and then there's a legacy to your life. Okay, na ito yung naging cause of death mo, and this may be something na pwedeng matutunan ng mga ano po, ng mga buhay pa na firefighters po. So those who are still living can learn from this death na so that it may parang future interventions na. So what can you do para maiwasan mo din itong line of duty death? Okay? So yun po yun. So next. Yeah, maraming salamat po. Thank you, Lord. That was very tiring for me. 2 hours 28 and no interaction with any of you guys. Tama ba? Or did somebody chat? Nope, nope, nobody chat. Yeah, that's the problem with this. May na mga nagtatanong na ngayon. Because I used to do this yung sa YouTube. I used to do this sa YouTube. Magpo-post ako ng mga ganito lectures, but you know, they don't get that much traction now. Pero I posted something 6 weeks ago about leptospirosis, and I was surprised that I'm getting views from it. Okay, sometimes these things take time para ma-reach yung aking audience because I'm not paying for people to reach me here. So uh, eventually the YouTube algorithm will pick up on it and then can suggest this, and then if it's found, any of the modules are found, saka pa lang ito magkakaroon actually ng traction. But I'm starting already right now, and I'm posting this on as many social media accounts as I can para matulungan yung iba, hindi lang yung medical students ko na tuturuan for this, para matutunan din ito ng ng maraming tao. Okay? Because it's still a present problem na yung mga causes of death is not following the proper format. Even though, as I said, na yung pong proper format has been available as a handbook since 2014. 10 years ago, it was already being taught. Okay, nagkaroon lang ng lull sa pagturo noong 2020. Kaya from 2020 to 2023 that we were trained, nagkaroon ng 3-year period na hindi naturuan. That's why when our city health officer learned that verbal autopsy is being taught again, pinadala niya agad kami. Okay, para maturuan sila. So yun po yun. Kaya po natin to ginagawa and I'm offering it for free, and I'm offering sana makita ninyo ito, and since if you are questions, you can use the comments down below. Hopefully makita ko siya because I've posted so many videos like this na nagkakaroon pa lang ng traction and comments after 6 years. So hopefully sana mas maaga makakuha tayo ng intervention kasi we need this to be shared to as many medical professionals as possible. And this is only offered by codes sa DOH Learning Academy. So it's not important na naka-access ka sa DOH Learning Academy. It's important that you get the code pa. Okay? So there's still a password, parang password pa na yun yung code na kailangan mo pang i-enter, and then it has to be taught live from trainers like me. So that's for me inefficient in the part of the DOH. Okay, and I don't like it kasi nga ang bagal. Hindi pa rin, ganun pa rin yung ano po natin, yung po method po. Okay? So let's go. So in here, since this is the last slide, maybe we could, go to the front. Naku, yun lang. Hindi talaga. Mahirap siya. Let's do this. Function home. Yan. Because I showed you the answers of my ano po. So in here. So paano na tayo maglalagay ngayon? Dito, di ba? Like in diabetic, so you don't need to put septic shock. You don't need to put septicemia. This patient died with a gangrenous left foot. Okay, so diabetic foot left. Okay? If there histopathology unknown. Pwede, di ba? Siya ilagay doon because that's the source of the infection. Okay, so nakalagay na doon yon since diabetic foot, hindi mo na kailangan ilagay si uncontrolled diabetes type 2. However, if you put gangrenous foot left and then the histopathology in here, you can place diabetes type 2 doon sa second line, And uncontrolled, okay, if you want to put uncontrolled, pero pwede yan diabetes mellitus type 2 lang. Okay? If you place it there, the diabetes type 2 becomes center stage. Okay? And then the gangrenous foot, tapos left, histopa, and cause unknown, it becomes this one lang. So two-liner lang to. Pwede to siyang two-liner. Okay, next. Ayan na naman. So, tanggal-tanggal. Kung alam si Staphylococcus, so this is a third degree burn. Tama na ba? Yeah. Doesn't have to be 85% TBSA. Hindi mo kailangan i-add. Okay. This is an infection. This what do you call this? Uh, pyoderma. Okay. You can place that in the immediate cause. Okay? Dahil dun sa may burn. Okay? So, third degree burn can be placed dun sa may antecedent cause. But this is an infectious disease. So, you follow the infectious disease na protocol po. So, you place it there and then the body, okay? Um, Maybe you can put 85%, pero hindi naman. So, it's usually pus growing all over the ano po. So, it's pyoderma. Yun ang pagkaalam ko. Or dermal infection, dermal abscess. Okay, so pwede naman yun. Okay, kasi para mas simpler, dermal abscess secondary to dermal abscess with staphylococcal infection. Staphylococcal infection on 85% of the body, pwede total body surface area dahil dun sa may third degree burn. Okay, pwede yun. Pwedeng ilagay po yun. Okay, it's external cause. Is it external cause? Yes, it's external cause. So, let's answer this one. So, pag external causes, hindi na po ito yung gagamitin natin. Skip, skip. So, this will be, yan po. Example of how I'm doing this. Oops. Doon sa mga external causes, yung, wait. There's a faster way. No, that's consulta. So, I'm also lecturing consulta kasi. So, there's a faster way. External causes. Here. Yeah, that from the infection. Pwede pa rin siyang death from the infection. Pero nga, this is an at alleged suicide po. Okay? So, this is an external cause. So, fatal derangement po. Okay, is the trauma. The burn. Okay, so, this is third degree burn. So, we're going to follow external injuries. Yung po, uh-oh. Let's go back to the slide. Sorry about that. Because I'm still using the pen and the laser pointer. Okay, so if you're going to use external injuries, the external event or the underlying cause is the physical or chemical in nature that caused the trauma. So the external event is yung burn. Okay, so the letter C should be the burn, third degree burn. Pwede mo ilagay or yeah. And then ano pala, yung kwento, kasi kwento to. Lalagay sa underlying cause yung kwento po. Burned herself by pouring kerosene on her body. Okay, so ito yon, magiging kwento po si underlying cause. And then dito sa antecedent cause, pupunta yung third degree burn. Okay, and then yung pyoderm, infection of the skin. Yeah. Secondary to the staphylococcal infection po. Okay, tapos yung kwento dito sa underlying cause, nothing to be placed on the other significant kasi nothing else was identified, but you will place suicide here. Okay, yung place of occurrence at home. Autopsy done? No. Autopsy done will be no unless specified. Okay, kasi you're signing the front parts. Okay, the back part, pagka autopsy was done, yes, you will not be signing this one. The front part. So this is autopsy no. Next. Sorry. Medyo mabagal ako ngayon. Okay po. So, wala na po ito. I think we discussed this na. Okay, wala na po ito. So kasi anemia, all of these are going out the window. This is a death of a maternal death. Okay, so this is a maternal death. Following dun sa may maternal death na format. Oh there. Here we go. Ayaw. Oh no, my mouse disappeared. Pagod na rin yung mouse. Ayan na po. So, you place it, yan, yun naman ang important yung sa ano po. You place it pa rin. So, the patient, ano to eh, if I'm right, this is uterine atomy. Okay? Yeah. You can place that there. Post, ano to? Is it puerperal infection? Yes, this is puerperal sepsis. Puerperal infection po. Tapos, it was identified na staphylococcus infection. So, puerperal sepsis can be retained pala. Puerperal sepsis, and then staphylococcus aureus. Okay? Yeah. Ayan, hypertension was managed. Involuted. Okay, so there's no therapeutic. Pero therapeutic, hindi siya therapeutic. So, okay. Transfusion. No, hindi naman yun yung pamatay. Hindi, against Staphylococcus aureus. So, it's not identified. So, unknown in etiology po ng kanyang uh, puerperal sepsis. Pelvic pain. This is PID. No? Fever, pelvic pain, saka yung pong fornices. Pwede actually ito as pelvic inflammatory disease. Unknown etiology. Yeah. Yun yung immediate cause. Insignificant conditions. No. Kasi sa maternal, no? Sa maternal, pagka namatay si baby, pwedeng ilagay si home delivery at saka multigravida. It's nice na nalagay niya, no? Okay. So, yun. So, yun yung pwede dito. PID, pelvic inflammatory disease, unknown etiology. So, that's a good one. Postpartum. Okay. Can be placed. Yeah. Yun. Postpartum, pelvic inflammatory disease, unknown etiology. Yeah. Antecedent cause, nothing. I cannot find any antecedent cause. Pwede rin yun. Uterine atomy. And then, underlying cause is the retained placenta. Wala naman ito. Possibility lang. Probable na retained placenta with a foul-smelling vaginal discharge. Okay. Probable. Pwede namang ilagay yung probable. Kung gusto lang po ilagay. Pero kung ano, pwede din naman na hindi. Okay? Kasi nga, yun nga. Pagka nag-iisip nga ng very pale without foul smelling vaginal discharge. Okay, so next. Tanggalin na si cardio. Ito, answer na natin to. Tanggalin na yun si cardiorespiratory arrest. Next, cerebral laceration, no? So, pagdating sa may injury, si underlying cause will be driver ba to? Yeah, driver. Driver of a car. What kind of car? Baka truck ang dala niya, no? Car in a in a collision. Okay? Tapos fractured skull we go to the immediate cause. And then, ano yun? Antecedent cause will be the, I keep forgetting that one. You have an example, di ba?
Oh my God. Yeah. Yeah. Blunt. And hindi naka-identify if it is ano, yun, open or closed. So if it is closed, it can be blunt trauma, blunt head trauma. Blunt head trauma, tapos yung kwento. Okay, so that's how you answer the pretest. Anyway, thank you very much for watching. I hope to see you on the next lecture. The next lecture, it will be showing you yung mga common mistakes na nangyayari po. I've already touched on them in here for the medical students. Pero kung gusto pa po ninyong makita po, that will add another 2 hours to your instruction po. So, I'll be having the test lang dun sa may apat. Okay, so those who want to follow lang po and complete the training, we can go with the next lecture po. Thank you very much. Hope to see you again on my live stream. Hope to see you in a live stream and mabuhay. Thank you.